evening. You're watching Impact News. I'm Rajnong Thongbam and welcome to Manunghuna, a 360-degree analysis of news and events. On 19th of this month, that was on Sunday, ICAR, Indian Council of Agriculture Research Manipur, announced an outbreak of bird flu in Manipur after samples from the poultry unit of the same ICAR were confirmed Aiihph virus. And since then, ICAR, along with State Veterinary Department and and the State Health Directorate, together are working on the door-to-door surveillance and culling of poultry. And yesterday itself, a 3-member team of experts sent by Government of India arrived in Influenza to see preventive measures taken up by the state government and also to have a stock of the situation. And tonight, we have all the 3 experts as a panelist on the show. And first of all, I would like to welcome Dr. S. Chatterjee, who is the virologist of Indian Council of Medical Research, ICMR, Kolkata. Welcome to the show. Appreciate you joining. Also joining us, Dr. Shalini Datta Lahiri, Associate Professor, All India Institute of Hygiene and Public Health. Welcome to the show. Appreciate you joining. And also joining us, Dr. Nivedita Das, who is the microbiologist, also from All India Institute of Hygiene and Public Health, Kolkata. Welcome to the show. Appreciate you joining, ma'am. So I would like to ask the first question to Nivedita, Dr. Nivedita, about your visit here in Manipur. I have heard that you will be here. I mean, the entire team will be here in Manipur for another couple of days. And you will be looking after what kind of steps have been taken up to to fight the outbreak here in Manipur. But so far, what is your experience? What kind of arrangement has been done by the government? Do you find the arrangement done by the state government is adequate so far?
We arrived yesterday to Manipur. We were sent by Government of India to look after the situation and report back, and whatever help is needed by the state, we have to report it back. On arriving here, we had first a meeting with the Director of Health Services, and we discussed in depth what the steps should be taken. They had started preparing, and once with our arrival, we could convince them, and they have started the active surveillance for the human cases, which is very, very important. Active surveillance has been started, and we hope to contain the infection if we get any cases. Next, we also had the meeting with the Deputy Commissioner, and he informed us that adequate steps have been taken by the administration to contain the infection among the poultry population. First, they have started culling. The culling has been started from 19th itself, and it is going on, and they are going to finish off it in 1 or 2 days, what they told us. And they have also restricted the movement of poultry and the sale of poultry just around the affected area. Okay,
just around the affected area. Here I would like to ask one question to Dr. Shivani Datta Lahiri. ICAR already declared that ICAR complex is the epicenter of the outbreak of bird flu. Why is it so? I mean, ICAR regularly brought in breeds from other parts of the country, and they do mixed breeding here in Manipur. Was it a laboratory experimental, a malfunction or defect, or was it because they brought breeds which are already infected? What was the real cause of the virus spread here in Manipur?
We went to the veterinary department today, and we learned from them that the infection started 8th of April, and they sent the samples to Bhopal, and it was afterwards confirmed. So it was confirmed on 18th of April.
Okay.
So as the samples were sent to Bhopal, and it is confirmed by the Bhopal laboratory, so we take it as very authentic data. So we cannot say that this is a malfunctioning of the laboratory, because Bhopal's laboratory is a very
No, I'm not talking about the Bhopal laboratory. I'm talking about the experiment being done here in ICR complex.
The thing is that now, in the present situation, as the virus is not circulating in any part of India, so if they bring some sort of poultry from inside India, any part from India, there is no. I think there is no chance of mixing of this virus, from transmission of the virus from
other states.
So it may be from the migratory birds. The virus may have circulated to them, and we have found that some areas are there around Aiihph where the migratory birds they come.
Do you think migratory birds are the only reason, or do we actually need to do we actually need to send another sample for reconfirmation of the virus for testing?
No, I don't think so, because it is already confirmed H5N1, so there is no point.
So that
of
confirmation
sending,
is.
that confirmation is, it is done.
Good enough. Okay.
It is good enough. We can rely on it. So there is
retesting
no
is not required.
No.
Okay,
There is
retesting is not required.
Retesting is required. And as the source is not detected so far, it is our assumption that it has been transmitted from the migratory birds, and there is no way you can stop the migratory birds, and you cannot cull them.
But there are other parts in the state itself, in Manipur itself, where a lot of migratory birds are frequently visible. So is there any chance of having this virus there also?
Now, if the chance is there, but if the virus is there, there will be outbreak.
There will be an outbreak. There will be death
similar
of
sort of outbreak.
Okay, poultry stock. Here I would like to ask another question, which will be a very basic question: how this H5N1 virus or the bird flu is actually originated? What is the genesis or origin of the virus itself?
Look, the influenza virus is not at all a stranger in our country or all over the world. This existence of influenza virus has been identified since 1819. And always we hear that it is H5N1, H1N1. These are the two parts of the virus, and these two parts are the protein part. One H stands for hemagglutinin, and the N stands for neuraminidase. And these two protein parts actually creates the virus. And there are 9 types of neuraminidase and 15 types of hemagglutinin. So this hemagglutinin and the neuraminidase always they are taking part for the mutation. And for your information, this influenza virus survives in the bird, in the animals, in the human, and in nature, always there is some genetic reassortment between H and N part. And
this will be, in simpler words, there will be adjustment of H.
Not adjustment, this is called genetic reassortment or the genetic changes. And it creates, if you go for permutation and combination, so that 9 and 7 can create good number of influenza virus strains. But it actually does not infect all the strains, does not infect the human beings. But once it comes to the human being, then it becomes very dangerous. First of all, the influenza virus was identified as H1N1. Then came H2N2. Then came H3N2. And now it has identified H5N1, the bird flu, and again another part of another influenza virus, that is H1N1, that has reappeared.
That is swine flu.
That is swine flu. So any moment, any time, that influenza epidemic can occur. And it is transmitted by the birds only. And another part is that if someone get infected in some places, and due to the fast migration, the people flew to other places, and thereby through sneezing and cough, it spreads. So any moment, any time, that virus can be transmitted from one place to one place to another.
One place to another, from one bird to another bird also.
From one bird to another bird,
Okay.
and when it comes to the human beings, it becomes very dangerous.
Okay, when it
For the
comes to human being, it's very dangerous. How dangerous bird flu is the real question. So I would like to ask this question to Lahiri ma'am.
Actually, bird flu is very dangerous. It is very dangerous to the extremes of ages. That is, the extremes of ages mean the old people and the children. And it is also very dangerous to immunocompromised individuals, like the people affected by HIV. Then we have the intravenous drug users, IDUs. Then you can have people who are in terminal stages of cancer on anti-cancer drugs. Then you can have people who are taking long-term steroids. Those are the immunosuppressed people. But usually the general people or the general public who are healthy, like you and me, are not so much affected. Well, we can get affected if we are exposed to a large number of viruses. If we inhale a large number of viruses, we can also fall sick. But at least in our general population, there is a antibody level which can fight the virus.
Okay.
But we are really concerned about the people who have that low antibody level, as I told you before. These are the categories of people who are likely to have low antibody levels.
But the same thing is also explained when we talk about swine flu, which is H1N1. And those people who are suppressed, who have suppressed immune system, they are more prone to H1N1 also. Here with H5N1 bird flu, the same thing is happening. So I mean, both the viruses, I mean, they are different viruses, as you have already mentioned, the combination and permutations of H and N. But here, my basic question is, I mean, like for H1N1 swine flu, people are so, afraid of the virus itself, the spread of virus. But here in case of H5N1, which is blood flu, how dangerous H5N1 is for human being in terms of medical facility, in terms of prevention?
H5N1 is equally dangerous like H1N1. And
So is there any cure for both?
Yeah.
Okay.
This is not a fatal disease. If it is detected in a very early stage and the medicines are offered to the patients, it is recovered.
Then what will be basic or primary precautions we can have, or we can do ourselves at home in order to stay away from bird flu?
Actually, the people who have the backyard poultry, they should have the idea to identify the early signs and symptoms among the birds, that the birds are getting the disease. So the children, they should not be allowed to go near to the birds.
Okay.
And people, those who handle the birds, they should take some of the preventive measures. So washing of the hands and to keep themselves away from the bird.
Okay, using sanitizers.
Yeah, sanitation. Sanitation. These things are very much necessary. Another thing is that you see, when the disease is detected in the bird, in the poultry, so we set the colors for culling. So this culling operation continues for 1 kilometer radius around that epicenter. So these colors, they are at risk because they are culling the birds.
Okay.
And they are doing it. So the personal PPE, what we say, that the personal protective equipment, they should have adequate supply of PPE. So they use the gloves, the mask and everything they wear before they go to this culling operation. So that should be properly maintained. And after that culling operation, the people who are engaged for these colors, they should be kept isolated from the general people. So that is known as a quarantine period.
Okay.
Because they were exposed to the risky birds, because they did this culling operation. So they should be put in quarantine. That means they are isolated from the normal people.
Isolation for how many days?
10 days
10
after
days, okay.
the last day of culling.
Okay.
So after the last day of culling, they will be isolated from common people. They should be kept separated, and that is called a quarantine period. And during that quarantine period, every day they should have a medical checkup, and the medicine is known as Tamiflu. So Tamiflu, they should have
Okay, same medicine which is prescribed for
this
swine
is
flu.
a preventive. And this medicine is given to them as for prevention of the disease, and a regular health checkup should be done, whether they are getting the symptoms and signs, whether are they developing anything like that. So for the colors, these sort of preventive measures are being taken, and for the common people, especially those who are exposed to the poultry, they should wash their hands and
Basic
sanitation.
Basic sanitations, washing hands as regular as possible.
To keep the children away from the poultry.
Okay, to stay away from the poultry.
And early detection whether the birds are getting the disease, that there is any discharge from the...
Any discharge from the
nose
poultry.
from the birds, poultry, and
any discharge from the poultry is there or not? We need to constantly.
The birds are becoming drowsy or fluffy.
But before going to break, I would like to ask one last question to Dr. Chatterjee. We are doing the culling operation in several parts of the country. Once the culling operation is done, all the poultry are killed and buried under the soil. After how many days or after how many months we can start farming of poultry once again? Is there any time period, like we have to, we can't rear, poultry for 5 months or 6 months? Is there any time, specific period?
No, that's not a specific period is there. But a month.
A month. After a month, we can start rearing chickens once again.
As because the virus cannot survive without any host.
Okay. Without any host, virus cannot survive. On the note, I would like to take a break. After break, we have a lot more to discuss. Let's take a break.
Mana nungtagi chariba maru marang yaw bachingjak sing siyang. Masin hakchang gi pangal amadi liver sohan batana tana. Puk naba acidity chaba tumdabana chingba kya narak priya.
Imana pirak hakchang ngakthukna hidak lairisidi lipse namanaba singa nungtigi party. Sanga chadrabadi sukya magyadabra adumna khangdramale. Masina puk naba thinbagi awaba thohan bayai.
Lipse nungtigi chabana acidity chaba tumdaba khong haba yataba phali. Aduga chak su lamale.
Liver bu farabadi punsisu super hit oire.
Welcome back. You're watching Manu Huna, a 360-degree analysis of news and events with me, Raj Rongthongbam. My next question is to Dr. Nivedita ma'am. Once a human being, a person is infected by bird flu, how will he or she come to know that he or she is infected? Is there any symptom or is there anything which we can easily identify that I am infected by this particular virus?
The symptoms is of a respiratory tract infection. So the person having fever, cough and cold, body aches.
All of these symptoms together?
No, not necessarily together. He might have only fever and cough and cold. He might have all the three together. These symptoms usually are the first symptoms. So if a person is having these symptoms, then he or she too should take medicine. He or she too should report to the health facilities, and then after taking medicine, if it continues, he or she, that the patient, we usually admit the patient to isolation wards in hospitals, and we have to take the samples. Then we have to send them to the designated labs in India. The designated labs being NCDC lab in New Delhi, and we have the ICMR lab where Dr. Chatterjee heads. So those labs, from there, the results will confirm the case. But a suspected case, we usually treat and patient usually gets well. But if it is a confirmed case, then treatment should be started from the first day only. You can't just keep the patient like that in order to confirm it. So if it is a confirmed case, then we understand, we will say, okay, we have got one case of bird flu in human. But till now, we don't have case here.
Okay, till now, there is no any case from Manipur who is infected by bird flu. Dr. Shivani, ICAR, which has been declared as the epicenter of the outbreak of bird flu in Manipur, which is again very close to state's largest hospital, which is known as RIMS, will it have any impact to the hospital? As it comes, under half kilometer or so. It is less than 1 kilometer.
Actually, people who are living within 3-kilometer area, within the epicenter, they are at risk.
So the hospital is within the radius from the epicenter.
Yes.
So it is
that is also in risk area, because that 3-kilometer area is the risky area or the target area. So it is within that risk area or in the target area.
So you will be here for another 9 to 10 days. So will you be visiting RIMS also, because RIMS comes under the same
tomorrow we'll
area?
be going to RIMS.
Okay,
tomorrow we'll going to RIMS to see whether they have set up the isolation ward where they can segregate the patients with the suspects and all these things.
Okay.
So tomorrow we'll visit there.
Okay, tomorrow the team is visiting RIMS and other important areas to see is there any isolation facility available in the hospital or medical facilities. And my next question is to Dr. Chatterjee. As you are heading the ICMR in Kolkata, I think it is in Kolkata. So what kind of, how many days or how many hours it take you to actually confirm that somebody is, really infected by the same virus?
No, actually, it's a very simple test, and it takes only 4 or 5 hours time.
So can't we have those facilities in Manipur? Why only in Delhi or Kolkata? If it is not a very lengthy process, it does not require a lot of technology or equipment?
Yes, it requires a lot of technology and very precious instruments are required. That is known as PCR test and the sequencing, something like that. So it doesn't take much more time to detect, but the laboratory equipment or to establish the laboratory is very costly. The ICMR laboratory at Kolkata, that has developed as the Rome was not built in a day.
Okay. It's a lengthy and a very huge investment in itself.
Yes.
But my basic question is like, what if somebody is infected by bird flu? How the diagnosis process will be done? How the sample will be collected? What kind of sample will be collected? Will it be a urine sample or the blood sample?
No.
What is the actual sample, and how will it be actually diagnosed?
Yes, the actual sample, it requires the nasal swab.
Okay.
Nasal aspirates, and it is taken by the swab, and the swab is dipped into the virus transport media, and then and there it should be kept in ice, and the transportation should be made to maintaining the cold chain until and unless it reaches the laboratory, and there processing will be started. But the problem is there. It is very difficult and very costly test. So only one sample or two sample is not recommended, as because some samples or at least 5-6 samples if I get, then the test becomes economic, or the whole set we have to use. That's why
if only one person is infected,
then
he has to pay.
But in the case of influenza or in case of outbreak or epidemic,
the cost will be automatically reduced.
As because the sample flow will be there. That's why we can test it very easily.
Okay, that's why if it is an epidemic case, then it can be tested easily. But if it is a very isolated case, then
very sporadic one case, then
it will be quite expensive for the.
We have to wait for some time.
To wait for some time.
Yes.
Okay, but so far, I mean, it is only for, I mean, you arrived here in Manipur yesterday and you started the surveillance today itself. What was the actual, I mean, do you find any challenge, or do you find, will it, I mean, this will be, easily gone? Is there anything?
Actually, today, actually, we are the public health personnel. So we take care of the preventive part. And we follow always the standard guideline.
Okay.
So according to the standard guideline, we are going for surveillance, the active surveillance, that is 3 kilometer radius around that epicenter. Now, we arrived yesterday and today the surveillance process has been started. So right now we are not in a state to comment on the process because it is just started and it will be continued for next 10 days. So here we'll wait and watch to see the progress of the activities. Then we can comment whether it is satisfactory or not satisfactory. But so far we can comment that the state government, they are doing their job and according to the direction what we wanted. So we got lot of cooperation from the DHS, the DC. We had meeting with them. So it's okay. It's I think it's okay for right now.
Okay.
It's okay.
As of now, everything is fine, but
Everything is fine, but
yeah.
we'll have to wait and watch for
Wait and
next
watch because-
7-8 days. Then we can come to the
okay,
conclusion.
after 7 or 8 days,
Yeah,
they can
because
be,
they will go every house to house to carry out this active surveillance process and see what
okay,
happens.
after a week or so, I mean, the team can actually make a conclusion about the entire surveillance. But my final question is to Dr. Nivedita. I mean, the virus is already there, and ma'am has already mentioned that there is guideline from the health department. What is the actual guideline?
The actual guideline is active surveillance, which has been started today. We have to find cases. We are concerned about people's health, so we have to find cases. Culling is going to take place to contain the infection in the birds. And for the people, we are very concerned whether there is any transmission. We want to check the transmission from the birds to the people.
Okay.
That is our main focus. So for that, the actual guideline which has been started today, and with lots of cooperation of the state government, the DHS, the health department, the active surveillance has been started, and we are hopeful that this all of us as a team can contain this infection.
Okay, there is a very interesting and curious question among the people that can we actually eat an infected chicken or infected poultry? Dr. Chatterjee.
It's a very nice question. For your information, the virus cannot survive after 56 degrees centigrade. So after cooking, when we cook the meat, it goes up above 100 degrees centigrade. So the chances are remote. But the question is there, when you will bring the meat to your house, who will clean?
Okay.
If it is an infected one. So
Before the
your
actual
family
cooking
members,
process,
your family member or your better half or someone, they will clean and they will prepare. They will be at risk. So that's why if you bring the meat and just directly put it into the boiled water, so it's okay. Then you clean up and or make pieces or everything you do, it is okay. But the raw meat, who will prepare or will handle, they will be, he or she will be at risk.
Okay, the chance is very slim, but then why should take a risk? Chance is very slim, but why should we take a risk? On that note, I would like to end today's edition of Manu Hurna, and I would also like to thank Dr. Chatterjee, Dr. Lahiri, and Dr. Nivedita Das. Thank you very much for coming to our studio. Thank you very much. I appreciate your joining.
Thank you.
Welcome.
That was today's edition of Manu Hurna, and thank you for watching Manu Hurna.